Today, I had the opportunity to talk with Dr. Annan, the Senior Director for the Center for Mental Health Care and Resources. So I wanted to ask you, what was your reasoning behind pursuing mental health as a career?
I've always been interested in psychology. As an undergraduate student at Rutgers University in New Jersey, I remember taking my first psychology course, and I was really interested in the material and understanding thoughts and feelings and behavior. But my first path was actually into research. But at a certain point, I became more interested, less in the brain and more in the mind, and more in behavior and people. And so I actually switched over and studied clinical psychology. And eventually that led me to working in mental health and less research and more practice.
What do you think are the greatest challenges that adolescents and college students face today?
I think the last couple of years and with COVID and with some of the the challenges that we've had around social justice, all of those things have kind of added some additional layers to what students are going through. A lot of incoming students right now may not have had the typical experience of high school, because it may have been interrupted by COVID. And part of the job of a Center for Mental Health Care and Resources, as we have here at Georgia Tech, is to help students to kind of integrate all of that and to understand that and to continue to be resilient and to push through to achieve their goals.
I know it is difficult to make predictions of the future, but I wanted to ask you, if you were to predict, how would you say that mental health challenges in higher education are going to be changing and how that landscape is going to look in the...
It is difficult to predict, but I think that in my role as the senior director, it's part of my responsibility to kind of forecast a little bit. We try to be as data-driven as possible in thinking about some of those types of questions. And I think one trend that we're seeing is we don't have a sense of what the specific problems will be for students, but what we do see is that stigma around mental health is going down. And so students are much more open, irrespective of the challenge or the problem or the obstacle that they're dealing with. They're more likely to want to talk about it, to want to seek out help. And there's less of this idea that there's something negative about being open about one's challenges and one's mental health. And so I think that is a trend that will continue. More students will be looking to talk and work on their mental health concerns and understand themselves and their lives better.
Would you mind sharing what is your favorite thing at Georgia Tech so far?
So far it's been a wonderful experience, and I've really learned a lot about Georgia Tech students and how engaged they are, how serious they are, how committed they are to their education, how focused they are on learning things that will actually change the world. I think the resources are also fantastic. I think that not just our office and what we offer in terms of mental health, but other aspects of health as well and well-being, I think is a major focus on our campus. And the individuals who provide those services and who provide those supports are top-notch. I think they are very engaged, they're very motivated. I think they enjoy the students. I think they like to see students doing well based on the services that they provide. And so that's something that really impresses me about being here at Georgia Tech as well.